Imagine depriving yourself of one of the essentials your body needs to survive: food. To many, it sounds unthinkable, but those who suffer from anorexia nervosa refuse to eat and will literally starve themselves to death. When Dr. Dennis O'Grady first realized his daughter Erin had an eating disorder, he tried everything to convince her to eat. She couldn't, and Dennis was forced to watch her wither away, powerless to stop it.
Erin was always a very, very compliant person, and she would try so hard to eat, but she really, all of her soul didn't want to eat at all. So she would hide food and make up excuses, and it was just really quite a struggle. But we didn't know what helped to get her. We didn't know. I didn't know as a clinical psychologist at a doctoral level what an eating disorder was. It wasn't a specialty of mine. And it just sends shockwaves through your entire family, your entire psyche, or your entire belief in the world.
Often afflicting young women in their teens, anorexia nervosa isn't truly about food, but about the inability to cope with emotional problems. Patients suffer a multitude of medical complications, many of which can be fatal. This makes anorexia nervosa the deadliest of mental disorders. It may take several treatment attempts to recover, but experts say never give up. There is hope.
Most people who are able to get effective treatment are able to recover. The first year is a very chaotic time for a lot of people, and there can be relapses and setbacks, but with effective treatment, many people will recover. That's one of the things that I think is very important for people to understand with eating disorders. There's a bit of a misconception about that, because people can truly recover and be free from an eating disorder. The critical aspect is getting that adequate treatment and effective treatment.
For many families, one of the greatest challenges of recovery lies in the expense of treatment. Many insurance policies provide initial coverage for eating disorder treatment, but prematurely withdraw this treatment because acute symptoms improve, or because patients do not meet what is called medical necessity criteria for coverage.
In anorexia nervosa, the failure to allow the patient to achieve a healthy body weight is a prime predictor of eventual relapse. In the other eating disorders, where the patient is not emaciated, there seems to be a prevailing belief among some insurers that the disease itself is not as severe as that of anorexia. It's a mistaken idea. Chaotic eating and purging behaviors can lead to emotional disarray, severe feelings of hopelessness, even to the point of suicidality, and even impact on physical health. And this can be expressed by dramatic shifts in fluid volumes and in electrolyte concentrations. It can occur in abrupt changes in heart rate and rhythm, and in some severe cases, it can even lead to the rupture of internal organs.
Insurers that understand the most recent research on outcomes know that providing the appropriate intensity and duration of treatment translates into long-term cost savings.
It's important to give somebody adequate time, but time isn't just the focus, and cost isn't just the focus. How well can I deliver that care? What's the incidence of reoccurrence of that care? And plan sponsors, insurers, employers are all looking to align themselves with medical providers that can provide the type of data that shows they're taking care of their people, but they're also doing it in a cost-effective manner.
Today, Dennis O'Grady's daughter is recovered, and Dennis wants to get the message out that insurance companies must offer treatment for eating disorders.
What I would say to insurance companies who are reluctant or who don't treat eating disorders, what would I say as a parent, as a person? I would say, shame on you. Shame on you. Do not think that the investment is lost. If it costs $10,000, $20,000, $30,000, it's spread over a lifetime of health and paying forward and helping others. I'm in the fortunate camp. There are people who don't have the money to save their kids' lives, and those kids die, and it's a crying shame.
River Center Clinic has helped nearly 1,000 adolescent and adult women overcome eating disorders. About 5% of sufferers are men. Located outside of Toledo, Ohio, the RCC delivers evidence-based, individualized care to help patients reclaim their lives and navigate the journey to lifelong health.
This is a very structured therapeutic approach to curing a very difficult disease. Number 2 is science. There are no gimmicks here at the clinic. It's all based on well-replicated, evidence-based research studies that are present in the scientific literature. Number 3 is refers to common sense or dollars and cents. The River Center Clinic, we believe, delivers treatment that is cost-effective and compares very favorably to that of more expensive inpatient programs, such as in hospitals and the like, and also compares favorably with the results one could get with a less intense type of approach, such as outpatient therapy, where you're usually meeting with a therapist 1 time a week.
The professionals at the RCC believe everyone in need deserves access to effective eating disorder treatment regardless of income. That's why the RCC offers their unique partial hospitalization program that allows patients to get care at a reduced cost.
The partial hospitalization program is a 5-day-a-week, 7-hour-per-day program that runs Monday through Friday from 11:30 in the morning till 6:30 at night. It includes individual and group therapy, and also everyone has a specialized eating plan that is devised specifically for them to help them overcome their eating disorder and help them achieve their treatment goals.
The River Center Clinic also offers an economical adolescent residential treatment program that is 24 hours a day, 5 days a week for patients 17 years old or younger. River Center Clinic is led by Dr. Michael Anderson. Dr. Anderson has become an advocate for eating disorder patients, lobbying insurance companies to provide adequate treatment.
We're often left with the irony of some medical insurance policies being willing to cover the renourishment of an 80-year-old woman who is battling with terminal cancer, but at the same time perhaps balking at the coverage of effective treatment for an 18-year-old valedictorian who has all the capacity to be a brilliant neurosurgeon.
A lot of people will talk about how effective the River Center Clinic or Dr. Anderson is with the insurance company. It's really not so much being effective with the insurance company, it's the level of effectiveness that they've had with their patients. Because where Dr. Anderson and his team have been effective is in really documenting not only the results of the care of their patients and the performance, but also to be able to do it in a cost-effective manner in comparison to other organizations providing similar care.
What's gratifying for me personally, and I know for the rest of the staff at the River Center Clinic as well, is that we do see people who are actually cured from the disorder, given effective treatment over sufficient time to accomplish this task. That's what makes it all worthwhile. That's what makes us so impassioned about seeking proper treatment for these unfortunate individuals.
When the bottom falls out of your life, don't lose hope. 2, there's help. 3, don't become desperate. There are places that will promise you the moon and deliver you dirt at a very, very high cost. 4th, go with what works, like the River Center. It's proven. There's studies done. There are daughters and sons like mine that are living proof that it works. They know what they're doing, and they do it well, and they do it with heart.
If you or someone you love struggles with their relationship with food, contact the River Center Clinic, comprehensive treatment for eating disorders. For more information, visit rivercenter.org.